Hello. I will be talking today about two topics. My name is Madison. The two topics today are for our biology final. The first one is COVID-19. It's the current pandemic that we're in. And the second one will be about antibiotic resistant bacteria. Both are serious medical issues that professionals are trying to combat right now and trying to come up with ways to fight against them. Um, First topic we'll be talking about today is COVID-19. Um, there's many names that it is being called right now. It's a novel virus, meaning that we haven't ever seen it before, like in the medical world. Um, Nobody's really sure how long it's really been around. But uh, it is from the family of coronaviruses, which are pretty common. They typically stem from animals and they mutate and transfer into humans. COVID-19 is also called SARS CoV-2. It basically wreaks havoc on your body. It's the best way to put it. Sometimes it's very mild, even mild enough that people don't show symptoms, so that can be contagious, but they won't know that they have it. And others, they don't come out so lucky. It has about a 2% mortality rate. Um, it kind of varies depending on area and like country, state, uh, and it's mainly deadly to people who are immunocompromised, which means like cancer, diabetes, um, if just high blood pressure, stuff like that. If you have pre-existing health conditions, you're higher risk of a more severe illness. Um, what happens is that it's spread through respiratory droplets. So, say you're in close contact, you're sitting by somebody on the bus or the train, and they're infected, and they're not wearing any like personal protective equipment, like a mask. That if they sneeze or cough or anything like that, um, those droplets that come out of a cough are like spread airborne, so they kind of go out into the air. And if you're breathing in and stuff like that, those droplets from another person, that can increase your risk of infection. So that's how it's spread. It goes airborne through respiratory droplets. Um, it is respiratory, meaning it affects the lungs. Um, it weakens your immune system, which a lot of the articles and stuff that I was reading said that it wasn't the virus itself that caused such a severe reaction, it was the immune system that did. So it was basically, if I was sick, my own body would be attacking itself, which can be um, seen in other things like HIV, which HIV, you don't really die from AIDS itself, you die from pneumonia or something like that because your immune system is weakened so much you're susceptible to other diseases, which is what a lot of people are seeing with COVID-19. A lot of times the patients will get pneumonia or something like that, or their lungs will fill up with fluid and um, just all kinds of things. Your lungs just get so weak they end up in a ventilator. And personally, I know somebody who works with these COVID-19 patients, and um, one thing I heard was about 80% of the people who end up on ventilators don't come off of them, meaning that they pass away. So it can be so severe once it gets to that point, it that mortality rate gets a lot higher. But it's not always that bad. Most cases are very mild. Um, a lot of them just recover at home. Luckily, it's not like the Ebola crisis where it can have up to a 50% mortality rate. But it is something that should be taken very seriously, because just because you have a mild case doesn't mean you spread it to somebody else. They won't. Um, it's spread within the close physical contact, like I was saying. It's typically 6 feet, so a lot of measures that are being taken is 6 feet apart, social distancing, wearing masks out in public. Masks won't always protect you, but they will, if worn correctly, can weaken the chance of spread. Um, Common symptoms of the coronavirus are cough, fever, chest pain, shortness of breath. Typically, it's cough, fever, and shortness of breath that they're asking for. As a healthcare worker, that's what we're required to ask for, is those symptoms. Secondly, the second part of this is vaccine and treatments. There are no official FDA-approved medicines or any vaccines. This, like I said, it's a novel virus. This is something that's very new to the medical world. So they're treating it with other type of medications. I know there was a doctor that said he'd been treating it with zinc and tonic water, which he's like, I can't tell you to use that, but it's just kind of stuff like that. They use other medications and treat the symptoms, and they have pneumonia, they treat the pneumonia and stuff like that. It's kind of like triage. You just treat what you can, and hopefully they will find a medication or vaccine. The it is an I think RNA virus, which RNA is it's like DNA. It's genetic. Um, that's the type of vaccine that they'll need, is an RNA vaccine. Um, there is the traditional, which is it's they're not genetic. They use a weakened version of the whatever illness, like the flu vaccine and stuff like that, and inject it. Um, uh, there are 3 types of vaccines that the National Institute of Health talks about in the article I was reading. There is the viral vectored vaccine, which is the traditional one. It's a stimulation of innate immune response, indication of T and B cell immune response. RNA vaccines do the same thing, but they're non-infectious, non-integrating, and they have a natural degradation, and they're egg and cell free. They reproduce more rapidly. In the article, it said within 4 hours that that there could be up to like 20,000 antigens in a cell just within 4 hours. So basically, the RNA vaccines are a little quicker in getting an immune response. Whether they're more efficient, there haven't been a lot of medical trials and stuff like that to support the efficiency of them. But as medicine advances, maybe that will do. But vaccines, they have to go through a long process, which they're projecting maybe a year more before there's a virus or vaccine out for the coronavirus or COVID-19. They have to go through a lot of trials to be approved. They have to be made and tested in labs. Typically, they inject rats and other animals with the illness, and they will test the vaccines and stuff like that on them. And same thing for the medicines and stuff like that. And once they're done and they get past like the human trials and stuff like that, if they're proven to be safe and efficient, then they'll, as long as they meet all of the FDA's criteria, they can be released into the public. But in conclusion, the novel coronavirus, known as COVID-19, is a public health emergency, and it should be taken seriously. It can be deadly to some due to the body's response to the virus. Even though you may not become very sick, you could potentially spread it to somebody else, and they could. So it's better to stay home, stay 6 feet away, and protect yourself and others. Currently, there are no official medicines or vaccines for the virus, but they are in the works. Many medical professionals have said that they're trying. They have a bunch of different treatment options. Yeah, that's COVID-19 wrapped up. The second topic is antibiotic-resistant bacteria. It's a growing health issue. Antibiotics were first seen in about 1929 when penicillin was discovered. It's used to treat all kinds of things. Now we're seeing a resistance to it. Some people can be allergic to it, and that provides a little harder way to treat. But how it happens is with the overuse of antibiotics. So antibiotics are used to treat bacterial infections. Sometimes they're used to treat things such as like a sinus infection, ear infection, and stuff like that. And those are typically not things that need to be treated. That's the CDC and some other websites were saying that those were not needed. Like antibiotics were not needed to treat those, because if you treat everything with antibiotics, eventually bacteria and stuff like that will become resistant to it. Also, if you don't take all of your antibiotics, so a lot of people, some people, I know I've done it myself. You get prescribed these antibiotics and you feel better and you stop taking them. Well, if you don't take them, then take all of them, then if there's bacteria still in your body, the antibiotics will be in there with them, and they can mutate and become resistant to them. There are some common types of bacteria, such as Staphylococcus, or the staph infection, or MRSA. They're known for being very difficult. I was reading an article about how deadly it can be, and there's not much you can do. They have been trying to use IV antibiotics instead of like pills and stuff like that. Try to see if that'll be more efficient and the bacteria won't become resistant to it that way versus just a pill form. Some others are their penicillin resistance, or Enterococcus, and multi-drug resistant Mycobacterium tuberculosis. A lot of times when they can't be treated, I know the staph they test, or tuberculosis they test, there's two types. There's two strains. There's the normal strain that can be treated with antibiotics, and the kind that cannot be. And if you test positive for the antibiotic resistant form of tuberculosis, they basically have to do what they're doing for COVID-19 and treat the symptoms. They don't have really anything they can do to cure you. And sometimes it can lead to death. How antibiotics kill bacteria? They basically, there's a couple different ways they can. There's some antibiotics that go in and they destroy the cell and kill the cells of bacteria, and the other ones, they go in and destroy them, make it where they can't reproduce, so the infection can't spread. If it's contained and the bacteria is not able to reproduce and grow and spread, and it's just contained into one area, eventually it'll die off and won't be able to spread anywhere else. There aren't really many alternatives to antibiotics. They said there's more preventative options like probiotics and stuff like that. Eat your Flintstone gummies. And doing things such as immunotherapies. So you build up your immune system, and the stronger your immune system you have, the more likely you'll be able to fight off the bacteria yourself. Some alternative treatments that I came across, they're not as effective as the antibiotics. But there's predatory bacteria and bacteriophage therapy. But in conclusion, bacterial infections were the cause of 30% of deaths before penicillin was discovered, and after that it went down greatly. But the more and more bacteria becomes resistant to antibiotics such as penicillin, the more deaths that we're going to see. So it's very important that we take preventative measures and try to combat this health issue of antibiotic resistant bacteria. Just remember, finish your antibiotics and eat your Flintstone gummies. Good day and goodbye.